So I'll try to limit my remarks, but have your pen ready and just write down freeclinicnewton.org. That's going to be mentioned in a minute. Everything I say you can find at freeclinicnewton.org. So the question is, why did I start a free clinic? Why am I starting a free clinic in the northwest part of New Jersey? I saw that I was frustrated with the flood of uninsured people in the emergency room for which I was getting calls. I'm an ophthalmologist and an ophthalmic surgeon, and I do eye surgery in my surgery center. I also see 10% of my private practice involves free care. I give that free care without any restrictions, and most of that free care is hidden inside my practice. That means the community doesn't see it. But I have the full liability when I see those patients, when I do surgery on them. It's the full liability that was bothering me. I was also personally frustrated that I was going on medical missions, traveling hours on airplanes to deliver free care when I had people blind that needed my services with glaucoma problems here in my community, yet I was leaving the nation. So many other doctors do that. And when I ask those doctors why do they do that, time and time again it comes back to the question that you know you've already answered, liability. And so I was really bothered. Then I discovered the Federal Tort Claims Act and the provisions that were provided in the 90s that allowed us to be protected by the federal government for malpractice coverage. If we identified ourselves as a free clinic, we sought protections, treated as unpaid federal workers in a free clinic. I was excited. So then I created this clinic through a 501c3 charity and then applying now for that recognition by the federal government. And what this does is it allows me to move my free care out of my private practice and all the liability that comes with it and put it into the community where I have then the liability insulation that comes with that free clinic status. And I can do surgery on those people in my surgery center and still have the protections of the free care and the protections of the Federal Tort Claims Act. It also puts the event of providing free charity care out in front of the community so the community sees it. I call that the Marcus Welby effect, and I definitely bask in the ethereal glow that comes from that. And the other doctors will also bask in that. And our practices and our stature as professionals within the community will rise back up to where they were in the past and where they've been eroded with all these interventions. There was actually some surprises that I've been encountering. That is to say, the clinical decisions that we can make in the free clinic without the liability overhanging us change the dynamic somewhat. We reduce our lab expenditures and we provide a care that is more streamlined. There's also an opportunity for individuals to practice to the fullest extent of their training. This is phenomenally important to people, doctors that are frustrated, doctors who have had to refer out for the cardiology and the GI and the hundreds of other subjects that they know they can do, but they haven't done that because there's specialists all around them. They can do that again, what they were trained to do, but they have lost touch with that inner self. There's also a surprising fact that charity, and I certainly agree, charity should be a local service, not something. I was commenting that when I put a check in the mail to American Red Cross to help the tsunami victims in Japan, I do have a warm feeling, but what more do I get from that? But if I see and the other people who volunteer drive by the facility and see that they're taking care of their very own members of their own community, there is a wonderful effect of keeping charities local. Fantastic. Finally, I also realized, it's not finally, it just keeps coming and coming, but one of the things I recognize is that there are no more candy stripers and there's no more orderlies in the hospitals. It's an unbelievable intrusion into the young people's attempt to try to explore the subject of medicine and whether that's their future. Where do they want to be? They're not able to change bedpans, escort grandmas, feed them, touch them. In a free clinic, they can come and they can do blood pressures. They can talk about the infections and put their hands on people who are infirmed. And I don't have to take my children to the Philippines for them to do that. They can do that here locally. And they can learn whether they want to be physicians and nurses and healthcare people. And so this is an opportunity that's phenomenal. And you know, those kids that come from high school and from different directions, their parents also want to donate to the clinic in order to support this activity that gives their children some direction. So again, it's the reclamation of what this is, a wonderful profession. That'll end my remarks so that we can save time.